Related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We're servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027, and I am your host, Louise Gomez. And today we have the honor of introducing you to Dr. Bilga Attar, and she is the medical director at the Legacy in Boca Raton. You can reach her directly at 561-483-9282, and her email is Bilga, B-I-L-G-A, Attar, A-T-T-A-R, at AOL.com. Thank you so much for joining us today.
My pleasure.
You know, welcome back to the show. I know we had you on a while back, but we like to invite some doctors. We like to invite back because, you know, you're doing so much in the community, and we want to acknowledge you for that.
Thank you.
Absolutely. So, Dr. Attar, can you share with the audience a little bit more about your, where did you go to school, your experience, and just a little bit more of your background?
Okay. Actually, I was born in Turkey, and my parents were physicians. So they came to United States 1958.
Okay.
And I grew up basically in Queens, Flushing, and Jamaica.
Yep.
And I grew up in New York and went to University of New York at Buffalo.
Oh, okay.
Yeah.
I say oh because I know it's cold up there.
Oh yes, very cold. I don't miss that cold. My first degree was chemistry.
Yeah, I find that so interesting because you were on the chemistry route.
Right, chemistry. And then I worked at hospitals doing blood gases. So that didn't, I said I need to go further. And I went to pharmacy school afterwards. So I became a pharmacist, worked at the hospitals in Buffalo and at Sloan Kettering Memorial Hospital in New York
another
City.
very good hospital.
I was actually taking meds to Hubert Humphrey, our senator back then.
Oh, I was going to say that name sounds familiar.
A long time ago.
Okay.
Yes, And finally, when I moved to Florida, I was working in retail pharmacy and seeing a lot of senior citizens coming into the pharmacy and trying to ask a lot of questions. And some of them needed medical attention right away.
Right.
So I thought to myself, I've got the two professions now. I decided to go back to medical school. Finally.
Wonderful.
Yes. I did my residency internship in Edison, New Jersey, in family medicine.
Nice.
Then I came back down to Florida, and here I am. Still working with senior citizens.
I see that.
That's exactly what I wanted to do.
I see that.
There's a big need for taking care of our seniors.
There is a big need, especially here in South Florida. There is a bigger senior population.
Yes,
And I think we're also at the time, from what I'm hearing, there's going to be like a big explosion of like the baby boomers that are going to be needing your type of medicine, that are going to be needing this type of, geriatric type of medicine. So can you tell us a little bit more about, let's say, your day-to-day, what you're experiencing, how many patients do you see, and
Well, I see a great need to take care of the elderly patients that we have now. And what I learned from them, and that goes for my generation, baby boomers, to try to keep yourself healthy as long as possible. See your physician on a routine basis, and make sure you have a quick access to medical care, which is very important. Don't let things go by. So on a day-to-day basis, I'm at Legacy most of the day,
Okay.
and we do get subacute patients now from Boca Raton Regional Hospital. And I have been in hospital since 1997 till 2022.
Oh, so you
where
have
I was
a
still
lot of
admitting
experience.
patients, yes. But since COVID came on, I did not want to go back to the hospital and then come to the nursing home,
Right.
just to reduce the risk of
Sure.
COVID
Yeah. Makes
infection.
Sense. Makes sense.
So when these patients come, some of them are still pretty seriously sick, so they need more attention. At the rehab facility, now we are able to give IV fluids, IV antibiotics,
Okay, good.
super wound care at Legacy.
Nice.
They have respiratory therapy, which is very important. When I
Yes.
see a patient with COPD
Yeah.
or CHF,
Yeah.
I can work with him to say, well, I want, please,
Nice.
the patient needs this, you know,
That's
and
great.
I can get it right away, so, which is good.
That helps.
Yeah. And then we have the long-term patients
Okay.
on another wing. These patients are a little bit more stable,
Okay.
but because of some of them have long-term chronic illnesses that are just going to be there. And every now and then it flares up. For example, yesterday I went in, I saw a patient. Oh, Dr. Attar, I can't breathe. I'm not feeling well. I said, okay, let's see you, you know.
Right.
So I took care of her, and she has COPD,
Okay.
and what we call exacerbation of COPD. So I prescribed her, I treated her actually like I would any patient in the hospital.
Right.
And the orders were placed. And today I saw her, oh, I feel much
Oh,
better.
see?
Dr.
That's
Attar, thank you. And what did my chest x-ray show? We have we can do Doppler ultrasounds, chest x-rays.
That's amazing.
Right at the facility.
I love that. It's like one-stop shopping.
Exactly,
right?
or they
It's
don't
like-
have to go anywhere.
It's all there.
Yes,
It makes
yes.
it so much easier.
Easier for the patients, and if we can avoid
Yes.
having them to sending them to an ER,
Yes.
that's great. And we try to do that without compromising the patient's health.
Of course.
If they need to go, they go.
Of course.
Yeah.
I did have a question for you, Dr. Attar. Do you have a couple of commonalities that you say, okay, I have these subacute patients and I have these other patients. Is there maybe a common thread that you say, I'm seeing XYZ with these patients? And is it something that maybe we, as wanting to be preventative and proactive in our healthcare, is it something that maybe you can let us know that maybe we can do before we get to that phase?
Exactly,
You know what I mean?
exactly. I mean, it's a healthy lifestyle. Let me just start with the smoking and
yes.
alcohol issues, right?
Okay.
Smoking is the worst. I mean,
Yeah.
even if they stopped smoking 30 years ago, we still see the
Oh.
problem later on in
Right.
life.
Right.
They have COPD. COPD is chronic obstructive lung disease.
Yeah.
And not only that, with the smoking, we see a lot of peripheral vascular disease, whether it's venous or arterial, peripheral arterial disease. And sometimes they get to a point,
Yeah.
and if they have diabetes on top, which is worse. And
Yes.
those are my
Sure.
routine patients.
Right.
And sometimes their circulations are so bad.
Right.
It's not just a lung disease cancer that everybody knows about, but it causes peripheral vascular problems.
Okay.
And sometimes they even go as far as amputation of the legs.
Oh,
I've
that's devastating.
It is devastating. So I would say number one would be never smoke.
Right. Right.
Two, it's the alcohol. Let's
Right.
go with the alcohol.
Right.
As we drink, I mean, in moderation, I guess once or twice a week or a couple of times a week, it's
Okay.
okay. But no
Sure.
weekend binging.
Right.
The alcohol immediately, I mean, as you take it, it turns into glucose.
Yes.
And eventually it turns into triglycerides.
Yeah.
And this is what we see in the elderly population eventually. And the fat surrounds the liver. And I'm talking in very lay terms
Sure.
right now.
Thank you for that.
And what we call cirrhosis of the liver, it's not alcoholic cause. Okay.
Sure.
So secondly is the weight gain.
Okay.
Everybody seems to get, it's a
Sure.
ongoing problem
Yeah.
with as we get older.
Yeah.
So if a person is diabetic, it's best obviously to try to lose weight,
Yeah.
healthy habits, life habits.
Sure.
Because eventually, if they don't
Right.
go with a healthy attitude, eventually they have abdominal fat formation. And it surrounds the liver. We
Yeah.
call it non-alcoholic cirrhosis of the liver. And patients,
Unfortunately,
it
I
causes
lost.
demise.
Unfortunately, I just lost a good friend of mine from that. So-
Non-alcoholic cirrhosis of the liver is
That's
just
right.
very common in diabetes.
That's right.
Yeah.
So from what I'm understanding, what I'm gathering, what you're telling me seems to be lifestyle choices.
Oh,
like
absolutely.
smoking is a lifestyle choice. Diet, drinking, these seem to be lifestyle choices. So what I'm understanding is if we maintain a healthy lifestyle, our chances, of having these types of ailments and illnesses will be less.
You'll be going with quality of life into your, as you age.
And that's what we want.
You'll have quality of life, which is important.
Sure.
You don't want to have to depend on anyone for your activities of daily living. We call it ADL, as you know.
Okay.
Right.
Yep.
So to maintain the quality of life as you're aging, it's a good thing to keep healthy,
Yes.
healthy habits.
Sure. And it's never too late, right?
It's never too late. No.
Like if there's someone out there right now listening and they're like, I'm 58 years old. I've been smoking and drinking, but
it's just they can still do it. I mean, exercise,
right.
eating healthy.
We're going to take a quick commercial break. When we come back, we're going to continue the conversation of healthy lifestyle.
Okay.
But I'm enjoying this so far. Thank you. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor, and we have Dr. Bilga Attar, And you can reach her directly at 561-483-9282. And the email is Bilga Attar at AOL.com, BILGAATTAR at AOL.com. So Dr. Attar, I'm enjoying this conversation about, you know, healthy lifestyle choices, right?
Yes.
Mm-hmm. It seems from what I'm gathering, a lot of things that you're mentioning could possibly be avoided with maybe better choices in food and better lifestyle choices.
Also, having a primary care physician
Yes,
is
important.
very important because
Yes.
even with the best of lifestyle,
Sure.
we still have to deal with diseases such as cancer, very quiet, breast cancer,
Yeah.
uterine, ovarian cancer.
Sure.
That's why I think it's very important to have a primary care physician to make sure that your routine
Yes. Checkups.
checkups are routine. Yes,
Mm-hmm.
like
Yeah.
scheduled mammograms, colonoscopies,
Sure.
checking your blood pressure, checking you for diabetes or pre-diabetes, your risk factors.
Sure.
It's very important. Your family history.
I was going to ask you about that, like genetics, and what role does
Genetics.
that play in our manifestation of disease?
It's very serious. I mean, I lost my sister for an ovarian cancer
I'm sorry about
at a
that.
very young age, but it's not in our family.
Right.
But I was able to access a geneticist doctor
Okay.
here in Boca,
Right.
and she evaluated my risk factors. It's very important if a family member has cancer
Right.
in the family to go and see your primary care doctor and see
Right.
what your risk factors are,
Sure.
and try to make sure you address it.
Yes.
Yeah. Besides having the healthy lifestyle,
Of course.
it's very important.
Sure.
Having a primary care physician is very important, and also be able to have ready medical access to an acute problem and chronic problems.
I agree.
Yeah,
I agree.
and we have great local physicians in town.
I was going to say, if anything, we're in the best area for
Mhm.
top-notch physicians. I
We
know
are.
that. We really are blessed
Mhm.
here in South Florida. I know there's a lot of really good doctors, and I had a friend who was recently in Boca Regional. Amazing doctors and healthcare there as well.
That's where I'm affiliated with, Boca
Okay.
Raton Regional Hospital.
Great hospital.
And we have great consultant specialists
Nice.
that I know of, at least in the past 22 years that I worked there.
Nice.
And I still have privileges, thank goodness.
Thank goodness. That's right.
Yes,
Yeah. And so, what do you think as far as how many patients are you seeing in a day? Like, what do you think you're?
Oh, with me,
You're-
it's difficult to say. I can see 17 patients a day
Wow.
or a lot less,
Okay.
because the patients that I'm seeing
Mm-hmm.
are pretty seriously ill. And before I see those patients who are just discharged from the hospital,
Okay.
after being admitted to the hospital into ICU, after seeing 7 or 8 specialists,
Wow.
and then
Yeah.
they end up at Legacy
Yeah.
in Boca Raton, and that's when I get to see them. So before seeing those patients, I have remote access to the hospital portal that I could review the patient's chart, history,
That's helpful.
their trending labs,
Nice.
and I read all the consultant recommendations, their progress notes. So at least I have an idea who I'm treating and what we need to look for, so the patient gets better with medical care
Right.
plus physical therapy, occupational therapy,
Sure.
respiratory therapy, and the nutritional services there. It's a whole team that we
I like that because it you know, if the patient has so many different team members working with them, you're all on the same page. So it makes it, it seems that it makes it a lot easier for everyone.
And we look at their problem list. I usually list the problems. And we want to make sure that patient gets better.
Yes.
And not get readmitted to the hospital as much as possible. So the key points, what we need to watch out for, maybe the patient is anemic.
Okay.
Maybe the patient has chronic kidney disease, now it's getting worse.
Yeah.
So we want to make sure their kidney issues are, we have to monitor them for their function of their kidneys. And also anemia. Keep an eye on their hemoglobins, hematocrits. Make sure they're not dropping it.
Right.
What the trend is from the hospital to the nursing home. So it's not easy. We get these complicated patients.
It sounds like it. And what role does having a family support system play in all of this? How does that?
Usually, my practice is after I see the patient. Usually, it takes me minimum of 30 minutes, sometimes 60 minutes, to review the patient's case from the hospital.
Right.
Then I'll see the patient. Most of the time, the patient is unable to give you any history, meaningful history, except maybe complaints they can give you.
Sure.
And then I call the family.
Okay.
I always call the family.
Nice.
To talk to them about what's going on.
Yep.
What the plan of care is going to be.
Yeah.
What to expect. The problems that may arise, so that we're all in the same thought. And also we talk about advanced directives of the patient.
What is
they're
that?
living well.
Okay, I see.
Their code status, I would actually, you know, what the patient would want. I mean, usually we get patients. I even have I had a patient 109 years old.
Oh my word!
I know.
109.
109.
Wow.
And she went through COVID like no problem.
Amazing.
Yes. We have,
That's amazing.
So we talk about advanced directives, patients' wishes, code statuses, towards the end of our visit with the family.
Makes sense.
So we honor their wishes, basically.
Of course.
So it's documented.
Nice. Dr. Attar, we actually have 2 minutes left. So what in the next 2 minutes, what would you like to share with the audience? Anything about maybe, I don't know, tips or whatever advice?
Since we're all, there's going to be a huge baby boomers that are aging at this point.
Definitely.
My big advice is try to keep a healthy lifestyle.
Yeah.
And make sure your stress level is down.
Yes, that's a big one. Maintaining stress, yes.
One of my best, closest friends is a psychiatrist.
Right.
He told me, Bilga, you need to go away every 2 months. I wish it were 2 weeks. Every 2 months you need to take off to de-stress. Nice. So you need to find time also to have that time for yourself.
I agree.
And also, besides your health, you need to think about your economical wealth and health. As we're aging, you do not want to depend on anyone.
Of course.
Or be a burden on anyone.
Sure.
I think everyone has that in mind.
Of course.
So those are important. Estate planning is important.
Thank you so much for sharing all your wisdom and knowledge and experience. We appreciate the amazing work that you're doing in the community. Thank you. It was such a pleasure.
It's nice seeing you
again.
Nice being here again.
Thank you, everyone. We'll see you next week on another episode of You and Your Doctor. Take care. Have a good night.